Good morning. Please welcome to the stage Lisa Lewis Person.
Good morning. Good morning, everyone. I am Lisa Lewis Person. I'm the Chief Operating Officer for ONC. I want to welcome you to the 2023 ONC Annual Meeting. On behalf of our National Coordinator, Dr. Mickey Tripathi, and the entire ONC team, I want to say welcome. It is great to see everyone in person. We have not been in person since January 2020, and it's good to see everyone back outside in our go-to-work clothes, all dressed up. My high heels missed me, and I missed them, so I'm excited today. Thank you so much for being here with us. We have an incredible lineup of sessions happening today, starting with the celebration of the first set of Qualified Health Information Networks joining the Trusted Exchange Framework and Common Agreement, or TEFCA. We also are hosting breakout sessions all afternoon, and we will finish the day with a fireside chat with our Deputy National Coordinator, Steve Posnack, and Abigail Norville, who is the Deputy Secretary General of the Netherlands Ministry of Health, Welfare, and Sport. Please don't forget to join the conversation on X using the hashtag ONC2023. Also, please make sure you've downloaded the annual meeting app to follow the agenda, learn about speakers, network with each other, and so much more. This morning's TEFCA celebration, as well as the plenary sessions happening this afternoon and tomorrow morning, are being webcast live, and the recordings will be available to view afterwards. Thank you to our Division of Public Affairs and Communications and all of the ONC team for putting this meeting together. And again, thank you for being here. We are going to have an exciting few days, and it's time to get us started. So it is my honor to introduce our Deputy Secretary of the Department of Health and Human Services. Deputy Secretary Palm is the Chief Operating Officer for all of HHS and is responsible for overseeing the day-to-day operations of the department. Previously, Deputy Secretary Palm served as the Secretary Designee of the Department of Health Services in Wisconsin. Deputy Secretary Palm also held a number of policy and operational roles in the Obama-Biden administration at HHS. I want to also personally add that Deputy Secretary Palm has dedicated her life to public service, and she is the epitome of what a leader should be. She is knowledgeable, intelligent, and strategic in all that she does, and she works every day to make sure we as leaders and staff in HHS have the tools and resources we need to serve the American people with excellence. I consider it a personal honor to call her our Deputy Secretary, and I'd like you to help me welcome Deputy Secretary Palm to the stage. Thank you.
Good morning, everybody. I don't know what Lisa was wearing on her feet during the pandemic, but I sat around on Zoom in my 3-inch heels the entire time. I know you all did as well. It's such a pleasure to be here this morning. I really want to thank Lisa for that very kind introduction. Ginny Rometty, who was the former CEO at IBM, liked to say that data is the new natural resource. And like all resources, it must be refined prior to its usage. But unlike other natural resources, overabundance is an issue. The sheer volume of data coming into the health sector is like a tsunami. The thing that really strikes me about that quote is that a tsunami can really be one of the most powerful and destructive forces in the physical world. We learn new things every day. We try, at least, to learn new things every day about how to harness that power and control it to minimize that kind of damage and destruction. And it's only when we harness the transformative power of data that we're really able, that we're sure we're able to use it for the benefit of people everywhere. And that's really why we're all here today and in the coming in the coming days. I also echo Lisa's welcome to the first in-person ONC annual meeting since before the pandemic. I know that the team at HHS and ONC are really excited to have you all here, and with record attendance. I think I heard there are about 1,600 attendees this year, which is really great, and we're really pleased to have you all. I want to congratulate Mickey and the team for pulling this all off and pulling it together. It's been a very busy week for them otherwise, and so it's a mighty team doing much work. As Lisa noted, we launched TEFCA on Tuesday. Yesterday, ONC released a very important HT-I1 final rule, and of course, I'm sure many of you know that Mickey had the pleasure of testifying in front of the Energy and Commerce Committee yesterday, which is a ton of preparation, not only for him, but for his whole team. And so really appreciate all that they have done, not only to get ready for this conference, but more broadly on the work that they do every single day. As I mentioned, as Lisa mentioned, we did launch TEFCA on Tuesday and celebrated the official designation of 5 qualified health network partners. At the event, the common agreements were signed, which immediately allowed for the exchange of information. I really can't wait to see in the coming years, in the coming months, how it transforms our work moving forward. As a gal who has a small preference for my colleagues at ONC and the work that they do, this really is an important moment in the evolution of ONC and the work that we all do together to build an electronic health information network that truly is nationwide. But TEFCA's not the only major issue we're dealing with at the department. I'm sure you are shocked to hear that. And today, we at HHS released our data strategy, which seeks to further realize the department's mission by advancing its management and use of data. It envisions data as available, accessible, timely, equitable, protected, and meaningfully usable for us inside HHS, for the public, and for all of us in partnership together. Data has, over the past few decades, really transformed health and human services in our country. Humans are being digitized through new devices and apps, monitoring technologies, which are tracking, analyzing, and storing, as you know, just massive amounts of data. And this is on top of the work that we have been doing, as noted, through TEFCA, through other things in our health IT space, in genomic data, et cetera, just again, the sheer massiveness of the amount of healthcare data is really something. Every second, an exponential amount of healthcare data is generated and mined for valuable insights. Today, approximately 30% of the world's data volume is being generated by the healthcare industry. The rate at which the amount of available data is growing outpaces any other industry. Together, the data generated from these technologies is fueling extraordinary innovations and opening new pathways to provide services and care. The data that is now available provides enhanced understandings of patient journeys, highlights important new treatment pathways, identifies underserved populations, and demonstrates the efficacy of interventions under complex circumstances. Proper use of the data will allow healthcare organizations to support clinical decision-making, disease surveillance, and public health management, and many, many things that I am sure we have not thought of. Of course, healthcare is no longer, and although maybe it never really was, focused solely on the treatment of patients. We are increasingly looking for ways to influence behavior, to promote health outcomes, and prevent disease that could be avoidable in the first place. There are an infinite number of applications and improving, everything from improving how we think about nutrition as it intersects with agriculture, to the way we identify and serve patients with particular nutritional demands, to responding to climate change and the impacts that has on health. and so many, many more. Data really is at the heart of what we do, and it should be at the heart of what we do at HHS. We use data to deliver the programs that our citizens rely on, and data to ensure we're doing it well. We use data to monitor emerging threats, and data to develop timely and effective responses to those threats. We use data to evaluate new treatments, and data to ensure the equitable distribution of our old reliable ones. The better our data, the more widely and insightfully we are able to apply it, and the better the health and well-being of the American people. Going hand in hand with the ways in which we try to be innovative in our use of data is our vital role and commitment to protecting the privacy and security of that data. We take very seriously our role in this space, and it runs through our data strategy and will continue to be a really important part of how we think about maintaining the public trust in the work that we do. The department has been harnessing data for years and years. We could talk about whether we've done that to the best of our ability and in all ways that maximize its use and effectiveness, but it really was time, in light of the rapid evolution in this space, to take another look and be strategic and put pen to paper on an updated data strategy. So let me talk just about a couple of things in the strategy. It really is attempting to further deliver on our mission by really improving and extending our data capabilities and ensuring that we're bringing the full power of data to some of the most pressing challenges that we encounter at the U.S. Department of Health and Human Services. We look to strengthen our workforce and the expertise we have within HHS. We look to supply our employees with modern tools and technology so they are better able to accomplish our mission and do their jobs. And moreover, the strategy really looks to coordinate and elevate our approach through a handful of use cases, including fighting cancer and preparing for the next potential natural disaster, public health emergency, et cetera, as we think about how we do whole person care in a real and authentic way. The strategy contains a number of priorities for improving our data infrastructure and capabilities department-wide, and I'll highlight just a couple of the major pillars. We really focus on fostering data sharing. One of the most powerful opportunities in healthcare is to align around a set of understandings. When something is working, we can replicate it, we can move that information out, and if it's not, we ought to be able to nimbly pivot and move on to a different strategy. And the pandemic is the perfect use case to think about something like that. We saw the importance of having data to understand how the virus was spreading, where we should deploy our resources, what the impact the virus was having on various communities, on our healthcare infrastructure, et cetera, allowing us to move and respond in ways that were nimble and responsive to what was, well, you all know what it was. Second, I will highlight the responsible use. It just seems, I feel like we say these things over and over when we really all lived it and we really all know it. Responsibly leveraging artificial intelligence. I think this is one where we as a department are very interested in not chasing this. We want to be strategic and thinking very seriously about how we as a department are using it internally, how we are thinking about its equitable deployment in the healthcare sector, and how we are helping be part of governance and a structure that gives assurance to the American people about the way AI is being used in healthcare. And there really are so many ways we already are within the department and will need to, in the future, use this technology. And the president has challenged us through the executive order to do a number of things, which will be anchored in a task force that we recently stood up to drive our strategy to make sure we are, as an entire department, thinking about the ways in which we're doing this work. As Mickey likes to say, we are a department of AI optimists. And AI-based technologies, again, not something you all don't know, really do have the potential to drive innovation, increase market competition, advance health equity, improve care and the patient experience. But we also believe in trust and verify, right? That we need to maximize the opportunities and minimize the risks, and that there's a lot to learn in that space and a lot of important work, again, to not be chasing. We want to be timely and in front of the way in which this whole thing evolves and develops. I mentioned this before briefly, but one of the most exciting parts of the strategy are the initiatives to promote greater access to data to advance cancer research, and as really part of the President's cancer moonshot to reduce mortality in this space by half in the next 25 years. And notably, I want to give a shout out to the enhanced role that this data strategy gives to the Office of the National Coordinator to look at and work on interoperability in the human services space, in addition to the interoperability work that they're doing in the healthcare sector. I think, right, we all learned the social determinants and the human services sector cannot be separated from the healthcare sector when you are in that kind of situation, right? Food insecurity, housing insecurity, the need for other supports and services really can't be separated from healthcare, and how we bring that system and its ability to talk to the healthcare system is a really critical piece of work that HHS should be doing. So in closing, the use of healthcare data really allows for improvements in patient care, faster, more accurate diagnoses, again, the integration of human services to put the people at the center of what we do, and really allows us to be more personalized and more informed in our decision making. At the program level, we think it can lower costs, simplify operations. Again, when we think about burnout and the work that our staff are doing, how do we use these technologies to support those underlying efforts that are so foundational to patient care and health? Without data, or the people, processes, and systems to use it effectively, our mission would be nearly impossible. But this data strategy, these efforts are really designed to advance our mission in really effective ways that we're very excited about. President Biden has made it clear that he believes that all Americans really do deserve to share in the full benefits and the potential of our digital future. And we at HHS have a critical role to play in ensuring that and really bringing his vision to life. And that's exactly what we intend to do. And we look forward to your feedback, for you helping to hold us accountable for what we say we're going to do, to be partners with all of you in executing against that vision, and continuing to learn from all of you as we advance our mission. So again, my sincerest appreciation to all of you for being here, for having allowing me to spend a few minutes with all of you. I hope you have a wonderful few days and a wonderful holiday season beyond that, and my sincere appreciation. Thank you very much.
Morning. All right, let me pull this up to make sure that everyone can hear. Can you hear me? Okay, great. Thank you, and good morning and welcome this morning. First off, I just want to thank Deputy Secretary Palm. The Deputy Secretary, who I hadn't met before joining the administration, in one of our first meetings, she talked about how in 2010, when she was working on the Hill, she was working on the decision about whether ONC should be a staff division or an operating division, and sort of thinking about, as many of you may know, ONC was sort of put into statute in 2010. We were founded by executive order, but then put into statute. And one of her comments, was, so where are we? Where are we with ONC? And what's the future of ONC? You've done the certification, you did meaningful use, and, and I said, well, I took the job. I mean, we're we're going to work on this, and she gave the direction to figure this out. There are tremendous needs that ONC can help with, and she's here to support us. And I just want to say, she has done that every day. So I want to thank her for being here first and foremost. And let me just say, all of you may have noticed that ONC is getting a lot of stuff done, and indeed this week is feeling like everything everywhere all at once. We've got TEFCA, the HHS data strategy, a couple of announcements coming from Danielle Carnival, whose thunder I will not steal, and excuse me, co-leading the HHS AI strategy task force that the Deputy Secretary talked about, and bringing together a couple of thousand of our best friends, and all of that in the same week. And and I forgot to mention that we did drop a rule yesterday too, and in case none of you had noticed that. And let me just say, we could not be doing what we're doing at the pace that we're doing it without the vision, leadership, and full-throated support of the White House, Secretary Becerra, Deputy Secretary Palm, Chief of Staff Sean McCluskey, and my fellow HHS agency heads, some of whom will be joining us later this morning. And of course, leadership from the top down is nothing if you don't have leadership from the bottom up. And so even more credit goes to the people who are actually doing the work. My ONC team, who really are our ONC team. And everyone in this room and on the live stream and all across America who have never heard of us, the tiny little agency. Anyway, I just want to say, it's our ONC team, and their relentless commitment to the mission every single day fills me with awe, pride, and most of all, gratitude. I'm not going to tear up. So I want to make sure that I said that and I don't forget, because it's just unbelievably important. So before I go into detail, and I could name names, but then I would have to go through all 180. Because another thing that's really important about a team and a small agency like ours is every single person's contribution brings us to where we are. Every single person's contribution. So let me, before I go on, let me welcome all of you. I think as the Deputy Secretary noted, and Lisa noted, this is the first meeting we've had in person since 2020. It is the biggest ONC meeting that we've ever had. First time in our history that we've had to close down registration, so we've got a lot of people on the live stream. And I want to thank all of you for being here. It's really important to us. And as we say in Massachusetts, I think we're going to need a bigger boat next year. So when I took this job almost 3 years ago, and sometimes that feels like 3 months ago, and often it feels like 33 years ago, I promised that if nothing else, I was going to be incredibly impatient. Impatient both with our ability to get things done, as well as our tendency to avoid risk. I do like to quote often Boston Mayor Michelle Wu, who notes that safe steps lead to mediocre outcomes in the government. And if we maximize the chance that nothing is going to go wrong, then we won't get close to the scale of change and transformation that the American people need and want. And I would note that that's especially true in healthcare. I testified yesterday in front of the House Energy and Commerce Committee and was asked by a congressman, where are we on implementation of the 21st Century Cures Act, which he noted correctly, that was passed a long 7 years ago. And I had so much to say, actually, that he had to cut me off because we ran out of time. Since 2021, we put the information blocking rules into effect. Done. Information blocking enforcement started. Done. Fire API and US CDI standards instantiated in rulemaking. Done. Appropriate disincentives in place. Almost done. And now TEFCA. Done. All of those things in place. On Tuesday, we held an event. On Tuesday, we held an event with Secretary Becerra and Deputy Secretary Palm to mark the signing of the TEFCA Common Agreement by 5 QHINs. We now call them that without qualifications. They're not potential QHINs. They're not approved QHINs. They're not candidate QHINs. They're just QHINs. And the eHealth Exchange, Epic Nexus, Health Gorilla, Kanza, and MedAllies, laid the legal and governance cornerstones of nationwide network-to-network interoperability called for in the 21st Century Cures Act. It's a real testament to their commitment to mission that they stepped forward and they did this without government funding, without authority from the federal government telling them they had to do it. And we're building on top of all the work that they and others, everyone in this room and others, have done for a number of years. It's the next evolution. It's not replacing it. It's not saying that that was a failure. It's saying that we need to get to the next level now. And the public-private partnership is what's important to get us to that next level. So it's really a celebration, I think, of everything that we've accomplished over many, many years, and everything that all of you and those organizations have accomplished, and saying, now let's get to the next level, working in partnership with the public and the private. Since that day, since then, which I mean less than 48 hours ago, we've had over 1,200 organizations that are actually live on TEFCA. They're actually live, meaning that they're listed in the electronic phone book and they are available for transacting. And transactions are underway. I think there's close to over 500, if not close to 1,000 transactions, including importantly, some individual access transactions. So individuals accessing their record from one QHIN to another, right? Which is one of the really important things we want to be able to do. And that's just in the last 48 hours. So we're really excited about, what's more to come. We're also excited, and I want to recognize the organizations who are just at the cusp of being able to join, that QHIN family. Commonwealth Health Alliance and No2 have also been approved for implementation. They're really hard at work getting to the go live status, and we're cheering them on. We're working with them. We know they're working really hard, and so we're really looking forward to that as well. And we look forward to being able to celebrate their going live. I also want to note 2 organizations that have publicly announced that they've submitted their applications as well. So we're happy to recognize them. SureScripts and eClinicalWorks have also announced that they've submitted their applications, and we look forward to working with them, assuming they make it through that process. But we're very excited for the bottom-up kind of activity and the excitement in these organizations stepping forward to get us to that next level of interoperability. An important part of TEFCA is sorry, I was just checking the time. An important part of TEFCA is to be able to elevate where we are today to that next level. And what does that mean? Well, first and foremost, it's sort of bringing together the network-to-network interoperability that we've been building as an industry for a number of years with FHIR API capability, and having that synergy take place, having TEFCA Trust Services being able to provide the scalability to FHIR that is lacking now in the market, but it's going to be really important for that scalability for us to be able to get the kind of adoption, the kind of use of FHIR APIs that all of us have envisioned and all of us are hoping for and desperately want. So as a part of, we've gone live, as I said, gone live using the IHE framework, the baseline IHE framework, which provides a bridge from the network capabilities that exist today to be able to put that under the governance model, led by our RCE, the Sequoia project. I want to make sure, actually I shouldn't have, I want to make sure I didn't give them tremendous gratitude as well for all of the hard work to get us here. But the next step, and it was a promise that we made early on, was that TEFCA was going to support FHIR Exchange. So we're working very hard on what we call Common Agreement version 2, with a target of, by the end of March, having that adopted, so that setting us up for FHIR-based exchange under the TEFCA umbrella in 2024. That's critically important for a number of the gaps that we want to fill. One of the benefits of TEFCA, I think, is that, as I said, it's the next evolution. It's helping us pick up where the industry has been able to take us, and then say, working in the public-private sort of partnership, how do we then fill in those gaps that are too hard for the industry to do alone? In part because they're complicated, really complicated. They involve federal government regulatory frameworks, a whole bunch of other things that the private sector can't possibly do on its own. And I think, as Deputy Secretary has noted in many occasions, the federal government is too big a participant in healthcare for it to be standing on the sidelines. I mean, at some point, the federal government has to be a part of this and has to be participating. So that's an important part to be able to bring that together, to fill in some important gaps. Who's been left out? Who's been left out of network interoperability? First off, there's something like 30% of hospitals, I think a larger fraction of physician offices who aren't yet connected to the nationwide networks that exist today. As hard as they have worked, they're still left out. So we want to be able to work with them, use our resources across the Department of Health and Human Services to try to lift them up and get them connected. And hopefully the clarity that TEFCA will provide in a world where there are multiple networks, there are state level, there are multiple nationwide networks, there are state local networks, that makes it confusing, that makes it hard for people to figure out what is interoperability. I just want to do it once and, and get it done. Hopefully that provides that clarity for them, as well as some of the authorities that we hope to exercise and the resources that we hope to exercise within the department to help to get them to that point where they can get connected. Individual access has been something that we've all wanted at a network level. FHIR-based capabilities are absolutely essential to be able to get that kind of adoption because of the end-to-end kind of assurance and security you need to be able to put in place to be able to make that happen. Public health. Public health has been left out of nationwide network interoperability because it's so complicated. And we're really, I just couldn't be more proud of our opportunity to work elbow to elbow with the CDC, with Dr. Cohen, with Dr. Jen Layden, and the entire team at the CDC, who is doing tremendous stuff. And I'm not going to steal the thunder on Dr. Cohen's remarks later, but there's a tremendous amount of stuff there that we're doing that that would be about directly leveraging TEFCA to support the public health community, both at the federal level as well as at the state, local, tribal, and territorial level. Payers have to be a part of nationwide network interoperability. They absolutely have to be a part of it. We're working with CMS, we're working with private payers, and we're really excited about the opportunities there. Again, I'm not going to steal the thunder from John Blum as he talks about that, but we are directly doing everything we can to support the CMS interoperability rule and the strategy there for payer APIs, both that are deployed by CMS as well as that they're putting into regulation for regulated payers. And that's an important part of bringing that together. So we've got the provider organizations, we've got payers, we've got FHIR APIs, we've got TEFCA being able to provide the scalability for all of that, so that we're all working sort of in the same direction to be able to accomplish the kind of interoperability that all of us want. And the kind of interoperability all of us want is that we stop thinking about it, that it just happens, right? That it just happens. That's the kind of interoperability that all of us want. Who else? We're working, you're going to hear later today from IHS. Roslyn So, the director of IHS, is here, from Sharif Alnahal, the VHA, as well as from Susan Gregaric from the National Institutes of Health, to fully embrace. One of the things that we are working on is fully embracing IHS, VHA, are very important federal care delivery partners, and the important mission they play, and being able to make sure that everything that we're doing with TEFCA directly supports those, those members and those patients who they serve. And with respect to the National Institutes of Health, Exchange Purpose 7, we call it. We've gotten tremendous, sort of support and excitement, I think, from our research partners in the federal government, NIH and FDA, who have already started, embarking on different types of network interoperability. But this helps to give, sort of more sort of tailwind to that, and it helps to give a structure for the scaling of that in a way that can help to support the, sort of the integration of research, public health, healthcare delivery, again, in the ways that we've all wanted. So it's not as siloed as it is today, and to be able to help us to accomplish, sort of higher objectives across the ecosystem. Local efforts. We are working very hard to embrace the state and local HIEs, have them be a part of this. I think as all of us know, network to network connection isn't about someone losing and someone gaining. It's a positive sum. And there's always sort of questions of, well, if I connect to that network, maybe I'm going to lose my business model, or they're going to steal all my business. And that hasn't been our experience. It hasn't been our experience across the internet, and it hasn't been our experience in healthcare. Every time we connect up networks, both sides win. Both sides win every time we do that. And so we want to work really hard to, with our state HIE partners on, being able to provide them the opportunities to connect up into the TEFCA network to be able to better serve their local needs, which are vitally important, but then give them the opportunity to, to have that on-ramp to the nationwide highway, when they want it and need it. I also want to call out some local efforts that are, really important, but are just the beginning. Because one of the things we've been doing also in working with state level efforts is to work with them. And many states are embarking on, very ambitious plans for what they want to accomplish in their states, and that's fantastic, right? That's absolutely fantastic. But we also want to make sure that they are taking the opportunity to make the best use of using federal supported infrastructure to solve their state and local needs. So they don't have to rebuild all of that. They can take advantage of that to support their local needs. It's just the internet. It's just the internet. So we want to be able to do that and help support that. So we've been working very hard, in working with Governor Newsom's team in California. Many of you may know about the data exchange framework. So I've been working hard with them to have TEFCA and the data exchange framework complement each other, so that you have the participation in TEFCA helping to support the data exchange framework requirements in the state of California to help support all of the great things they're trying to do in the state of California. I also want to point to the work that Governor Cox and his team are doing in Utah with One Utah. Again, terrific work that's being done, and we look forward to being able to have TEFCA support everything they're doing as well, which is where they're pointed as well in the work that they're doing. And importantly, a lot of the work they're doing is leading edge work for fire-based exchange as well. And we look forward to the opportunity to have TEFCA help them scale, what they're doing in Utah as well. So, we've talked a lot about what we're doing here with TEFCA. Talked a lot about the QHINs, that the 5 QHINs, the set of QHINs, potential QHINs, candidate QHINs, applicant QHINs who are in the queue. One question that often comes up is, well, is that the composition of QHINs that we wanted? Is that what we wanted it to look like? Is that, kind of, part of the vision? I'll just say we were agnostic. From the beginning, and I count the beginning as, going all the way back to the Jason Task Force that Dr. McCauley and I, presented the Jason Task Force report that Dr. McCauley and I, then of Cerner, presented to then the HIT Standards Committee and the HIT Policy Committee about API-based exchange and, sort of thoughts on interoperability. A couple of core constructs were a part of, of that report that got a lot of, resounding support, led to the founding of the Argonaut Project, a whole bunch of other things. But there were 2 pieces to that report. One was about FHIR APIs and the importance of FHIR APIs. The other part of that report was about the importance of network organizations to be able to be the facilitators of exchange. Then we called it the public API, was what we said those network facilitators would be doing. Implementing a public API for exchange, network to network. And one of the fundamental principles that was in that report was that networks aren't defined from the top down, they're defined from the bottom up. It's the market that decides what's a network. What brings us together, those of us who participate in this network? What business, clinical, geographic, sort of drivers bring us together? And the idea of a nationwide network to network interoperability is to say, let that happen from the bottom up, but then they agree to a certain set of terms and conditions and technical means to exchange with each other. But we're not going to try to dictate. We tried that at ONC, right? Many of you may know. We tried that 10 years ago with the state-level grant program and with HIEs. We learned a tremendous amount, but one of the things that we really learned was that you can't dictate from the top down what a network is and where it makes sense for people to connect up, for business purposes in a network. And so I think that, a core construct here, and back to this question of, is this the right mix, the right composition of QHINs? Again, in the right number? Our answer is, we're agnostic to it. The idea is to support what the market wants to be able to do within a policy framework that supports the public interest at the end of the day, and with open industry standards that allow that universal floor of capability for anyone to be able to communicate nationwide with anyone else, regardless of which network they're in. Before I leave the stage, I just wanted to call out one other thing, and the Deputy Secretary mentioned it in the data strategy, which is specifically about enabling whole person care delivery by connecting human services data with healthcare data. We at the National Coordinator's Office have had a focus for many, many years on the clinical side, on the health side of the Department of Health and Human Services. And as we move forward, all of us know the importance of bringing together health and human services. It's in social determinants of health, it's in all the social service work. Every Medicaid program is thinking really hard about this. All of us know that that whole of person construct is incredibly important to being able to serve a person's real health needs, not just the needs that they have when they get sick, and show up at a doctor, or God forbid, show up in the hospital or in the ICU in the emergency department, right? That's been our focus of interoperability, but I think we all appreciate that's not health. Health is the entire picture, and health is about those folks who participate in our human services programs administered by the Secretary and bringing that together as well. So we're really excited that the department has delegated to us responsibility for now working in the human services side of the department to build interoperability, working with our partners at ACL, ACF, CMS, and others, in the department, so we can work directly with them to help support their real desire to have the standardization of the kinds of data needs that they have, and to be able to bring that together and more deeply integrated with the healthcare delivery side. So let me now end and get us to the next part of the agenda. One of the things that I think is really important on this journey that we're on is if you think about the Gartner hype cycle, right? And some of you may have seen this slide that we like to use sometimes of sort of the health IT version of the Gartner hype cycle, where we identified medical errors and we need more health information technology, going all the way back to to the 1990s with the Institute of Medicine report onto error is human, and then sort of pointing out with the founding of ONC in 2004 and a lot of work that we need health information technology as a part of that equation to improve safety and to improve the efficiency, affordability of the healthcare delivery system. We had the Meaningful Use Program, high tech, everyone really excited, $35 billion in federal incentives, Meaningful Use Stage 1, really excited, still excited, Meaningful Use Stage 2, really excited, and then turning the corner, Meaningful Use Stage 2, and oh my God, this is really hard. This is really hard. And this is really, it's like Gantt charts and project plans and my revenue cycle being interrupted, and do I really have to do this? And can I give the money back somehow? Right, all of that. And we went into the trough of disillusionment, all right? With Meaningful Use Stage 3, and then the 21st Century Cures Act in 2016, the recognition that, all right, we got to get ourselves out of this, and we need to, sort of supercharge, what we're trying to do in here. I would argue that it was starting to happen, because that is every single technology trajectory. We are not unique in that regard. If you look at every single technology trajectory, right? The Gartner hype curve wasn't about healthcare. It was about technology in general. It just so happens that we kind of match the curve, right? Just like every other industry does. But the 21st Century Cures Act was incredibly important to that. And to be able to get us where I'm really excited, about everything we're doing, because I think we're on that slope of enlightenment. And that slope of enlightenment is about having the digital foundation in place, about having mechanisms to make interoperability easier with TEFCA, FHIR APIs, about information blocking provisions that encourage people to, use those, those rails that have made interoperability easier. But most important to all of that is about saying, how are we going to use all of this infrastructure to actually solve problems? Like, there's one thing to get it all in place, right? You have to get it in place. You have to get us from paper to electronic. You have to make sure people get paid, right? Revenue cycle has to happen. Transition from paper to digital has to happen. All of that needs to get put in place, and you need to build the infrastructure so people can share information. That's all now just table stakes, hopefully, right? It's just table stakes. But now we want to say, what are the things we want to accomplish? And one of the important things is supporting the White House Cancer Moonshot team and all of the people in the country who have cancer. Deputy Secretary Palm talked about the goals that we have with cancer, 50% reduction. And I'm delighted that Dr. Danielle Carnival is here to be able to talk about the exciting work that they're doing and all the work that we're doing to help support them. We couldn't be prouder of being able to support the White House cancer efforts and cancer efforts at large as one of many kinds of things that allows us to take the corner to say, how do you move from just infrastructure to actually infrastructure to solve people's problems? So let me introduce Dr. Danielle Carnival. She's the Deputy Assistant to the President for the Cancer Moonshot and Deputy Director for Health Outcomes in the White House Office of Science and Technology Policy. She contributes to the Biden-Harris administration's efforts to improve health outcomes for the American people, including leading the effort to achieve the President's goal of ending cancer as we know it. Danielle earned her PhD in neuroscience from Georgetown and BS in biochemistry from Boston College. Hey, Boston College, that was in Newton. I didn't know. I need to, we need to talk about that, Danielle. I will say one other thing before Danielle comes up is she has been a tremendous supporter of everything we're doing, and we just couldn't be prouder of trying to do everything we can to support Danielle's efforts and the entire team's efforts at the White House Cancer Moonshot. And in turn, she has just been so supportive of everything we're doing and helped us, get to next levels with the entire industry as well. So let me get off the stage now and introduce Danielle Carnival. Oh, there she is.
Good morning. We will have to talk about Newton. I spent my freshman year on that campus. It's great to be here, and Mickey is always a tough act to follow, but I will see if I can live up to it. Thank you for the opportunity to be here today to mark this critical milestone in the evolution of TEFCA. The Biden-Harris administration has worked to invigorate TEFCA under Mickey's leadership and to make sure it works for healthcare and works for patients. In February of 2023, OSTP joined to urge the QHINs who had stepped up to sign the common agreement to go live before the end of 2023, rather than waiting a full year till February 2024. And it's great to see how many organizations have done just that, and just under the deadline here. And now with 5 qualified health information networks going live with their exchange of health data within the TEFCA framework, and 2 more, as I understand, poised to go live, we are seeing the vision of the 21st Century Cures Act and the commitment that President Biden made as part of his cancer moonshot starting back in 2016 to deliver a health data system that drives progress and improves patient care, and the work of so many of this in this room. We're seeing that come to light. As President Biden has spoken about many times, access to the right medical information at the right time can be a matter of life and death. The difficulties caused by disconnected health record systems have been particularly acute for patients in rural and underserved areas whose care facilities are often not connected to larger networks. Easier data sharing gives patients autonomy, because every patient should have the right to obtain and review their own medical records and share them with other doctors they want to include in their care. As you know, there is so much data collected in different health systems. If we make it shareable and accessible to researchers, we can unlock new knowledge and its potential to drive new treatments. If health data can be shared across systems, it's easier for researchers to identify new patterns that can improve health outcomes and make a meaningful difference in individuals' lives. Data accessibility across systems also makes it easier for researchers to find patients who may benefit from taking part in a clinical trial, and to extend the opportunity to people suffering from disease. In this way, TEFCA is helping to move clinical research closer to the point of care, into real-world settings, to avoid duplicative systems and truly unlock the potential of health data. In February of 2022, the President and First Lady reignited the Cancer Moonshot and set bold but achievable new goals to decrease the cancer death rate from cancer by at least 50% over the next 25 years, and to boost support for patients, caregivers, loved ones as they navigate a cancer diagnosis. That means saving and extending more than 4 million lives by 2047. This is real impact. I lead this initiative for the President, as Mickey said, and we've set priority actions, including to close the screening gap. We mean the one that was exacerbated by the COVID-19 pandemic, but one that has had inequity for decades. To understand and address environmental and toxic exposures, to decrease the impact of preventable cancers, think HPV vaccination and approaches to decrease smoking and improve nutrition. To drive innovations to reach patients and communities, which is a huge focus of the work here today, and to better support patients and caregivers. We've made a great deal of progress. You can go to whitehouse.gov/cancermoonshot to see all of it. I won't go through the full list, but we've announced roughly 50 new programs from the Cancer Cabinet, our cross-interagency leadership in new programs and policies and resources to address these 5 priority areas. And more than 100 private Companies, nonprofits, academic institutions, and patient groups have stepped up with new actions and collaborations. Steps to improve equitable access to effective smoking cessation programs, game-changing actions to reimburse for patient navigation services, services that can support a person through a diagnosis, treatment, and survivorship. Steps to partner with community organizations to bring cancer screening to zip codes around the country, people who are too often left behind, and so we can get a cancer diagnosed early when it's most treatable and we know the outcomes are better. Steps to drive breakthroughs through a new agency, ARPA-H, and actions to drive down costs for patients. And CMS rolled out a new payment model, the Enhancing Oncology Model, or EOM, to bring effective patient-centered care that improves outcomes for those facing a cancer diagnosis and lowers care costs. There is no question that today's new milestone level of participation in TEFCA will help advance these priorities. In alignment with TEFCA's interoperability goals, the Cancer Moonshot has worked with ONC, the NCI, and others on the creation of US CDI Plus for Cancer, which supports the inclusion of key cancer-related elements in a person's electronic medical record, including critical information about a person's cancer treatment, test results, and disease status. US CDI Plus for Cancer will ensure that this information, which is critical for patients' care, will be present in the electronic medical record. And through TEFCA, these records can be available to providers across the health system. Additionally, as part of an OSTP-led clinical trials readiness initiative, we collaborated with ARPA-H on a first use case for its ARPANET-H, its nationwide hub-and-spoke network that will drive innovation across our communities to improve the lives of people with cancer and other diseases. In a critical step forward, the Biden Cancer Moonshot announced with ARPA-H its commitment to accelerate and improve clinical trials for cancer and other diseases as a first project for that hub-and-spoke network. And through the Advancing Clinical Trials Readiness Project, ARPA-H will challenge participants to innovate in key areas such as pragmatic trial design and faster and more inclusive patient enrollment, more efficient data capture. This investment by ARPA-H is just one piece of the puzzle. OSTP is working across the federal government and with the private sector on additional actions, working with ONC on the HL7 Fire Accelerator and with the HL7 Fire Accelerator community on faster clinical trial data capture. Vulcan, together with Codex and others, have stepped up to speed the development of standardized approaches to data exchange with the goal of piloting faster and more inclusive data capture for multi-site clinical trials. We're coordinating the clinical trial readiness efforts with other initiatives within the Cancer Moonshot, like CancerX, a public-private partnership established to drive innovation in the fight against cancer, including through demonstration projects piloting new technologies for research and patient care. And under the National Biodefense Strategy, which calls for a more effective clinical trials infrastructure with more rapid response capability. We fully believe that to achieve the goals that the President and the First Lady set out as part of the Reignited Cancer Moonshot to end cancer as we know it, we must come together to improve data standardization, interoperability, sharing, and access. I'm pleased to announce today that a number of electronic health record companies and other leaders are stepping up to answer this call. The National Institutes of Health, CMS, and ONC will coordinate a Cancer Moonshot data sprint with electronic health record developers to adopt core EOM data elements and support a FHIR-based approach to sharing for 2024 reporting. This includes Epic, Oracle, Ontada, a McKesson business, Meditech, Flatiron, and TimeCare. I expect that others will join this momentum and make additional commitments supporting US CDI Plus for cancer to follow over the coming weeks and months. CVS Health and Athena Health are already working to promote these steps in their work as well. These commitments are not to us, but to the clinicians who use them to improve patient care. We are thankful for this voluntary action to provide more time for clinicians to focus on the patients they treat. We heard from them and their practices on the value of developing these systems with end users in mind. And these commitments will speed breakthroughs and deliver improved outcomes for those facing cancer. This effort leverages the minimum common data elements for cancer, or MCODE, as well as public-private collaboration within CancerX. Mickey mentioned the importance of TEFCA for scaling the adoption of FHIR-based APIs, and these new commitments from EHR companies will drive further adoption of FHIR standards as well. I'm excited to see these commitments to data quality and interoperability, which will expand the reach of the EOM and ultimately improve how we learn from the experience of more patients and improve the quality of care for people with cancer. Thank you. I also lead the Health Outcomes Division within the Office of Science and Technology Policy, and one key component of securing better health outcomes for all Americans is speeding the availability of better treatments for cancer and other diseases. We aspire to a future in which everyone in America can live a long and healthy life, irrespective of zip code, gender, and race. We know that we can get there with moves like these, when companies, healthcare providers, researchers, and communities pull together and focus on outcomes beyond their own interests. And I know the Deputy Secretary talked about this a little bit, but also today, the U.S. Department of Health and Human Services released its data strategy, which seeks to further realize the department's mission by advancing its management and use of data to improve human health outcomes. It envisions data that is available, accessible, timely, equitable, meaningfully usable, and protected, and can be effectively used by HHS, its partners, and the public. In support of President Biden's unity agenda, the strategy promotes greater access to data to advance cancer research and improve patient outcomes and advance the goals of the Biden Cancer Moonshot. And finally, the President has made clear, including by signing a landmark executive order on October 30th, that the entire Biden-Harris administration is committed to placing the highest urgency on governing the development and use of AI safely and responsibly to drive improved health outcomes for Americans while safeguarding their security and privacy. The administration is pulling every lever it has to advance responsible use of AI in health fields, but we cannot achieve the bold vision the President has laid out for the country with the U.S. government action alone. In response to the administration's leadership, leading healthcare providers and payers have today announced voluntary commitments on the safe, secure, and trustworthy use and purchase of AI in healthcare. These voluntary agreements build on ongoing work by the Department of Health and Human Services, the AI executive order, and earlier commitments that the White House received from 15 leading AI companies to develop models responsibly. All told, 28 providers and payers have joined in these commitments today. For more specifics and details about all of the entities stepping out, check out a blog post today that will be coming out from the White House. We commend ONC and those who are going live on the progress to date, but it's imperative that the work continue. As Mickey pointed out, and the President has often said, public-private collaboration is critical in driving forward the goals of TEFCA and reaping the benefits of interoperability. Today, I'm calling on all health networks, vendors, and the entire community to support National Health Information Exchange to advance the Cancer Moonshot, drive biomedical research and innovation, improve public health and prevention, importantly, as Mickey pointed out, and deliver the future that TEFCA puts before us. On behalf of the Cancer Moonshot and this administration, I'd like to thank ONC and all of the companies and organizations that have made today's suite of announcements possible. While there is work to do, today marks significant progress and will save and extend Americans' lives. A decade of steps to get here can get caught up in the acronyms and technical specifications, and I want to center us on the goal. The Cancer Moonshot is personal to the President because cancer is personal to his family. It's personal to me, as I'm sure it's personal to every person in this room. It's personal to every American family. That is what you are changing by stepping up. That is what you are delivering on by being part of this progress. The progress is seen in more moments with loved ones for people facing serious health issues. Progress is seen in a physician armed with the information needed to effectively help their patient. The progress is seen in the development of new knowledge and in more supported care. That's what is possible, and I thank you personally for being part of it. And now, I'd like to turn it over to Senators Tammy Baldwin and Bill Cassidy, who were unable to attend in person, but have shared messages of support by video. Thank you so much.
Dr. Bill Cassidy and Louisiana United States Senator Bill Cassidy here, thanking you all for attending this year's ONC 2023 annual meeting. I emphasize that I'm from Louisiana. Long before I was in politics, Hurricane Katrina hit Louisiana, and patients who were in chemotherapy, or renal dialysis, you name it, were dislocated out of southeast Louisiana across the nation. And at that time, there were workarounds that would allow an oncologist in Baton Rouge, Shreveport, or Monroe to be able to get the records of someone who was under chemotherapy in New Orleans to continue that therapy. It showed how much sharing medical data could change a life, even if the way we did it then was quite cumbersome. The COVID-19 pandemic highlighted the importance of the healthcare system being able to share information as well. And during the pandemic, struggles to achieve full health data interoperability delayed communication between docs, patients, and public health entities. A little bit of a difference. It wasn't patients being displaced as much as data was not being shared to those who were trying to use the data in a different means. So as a physician, and now as a senator, who's treated patients for over 25 years, and now represents patients, if you will, in the Senate, I've learned that it's essential to have a patient's complete health record to make the best recommendations. Now, we have EHRs, we all know, initially extremely burdensome. The systems did not permit sharing one with the other. Patients oftentimes had little or no access or control over their own health information. So when Congress passed the 21st Century Cures Act in 2016, Congress focused on how to solve the challenge of data interoperability as well as agency. I'm proud to say there's been a lot of progress, and you have been critical to that progress. The Office of the National Coordinator for Health Information Technology, ONC, has taken important steps to prevent information blocking, which some entities abused, allegedly, to limit patient-provided access to clinical health data. I smile. I once went, after we had spent all these billions of dollars on electronic health records, to get my mother's health records to take from one system to the next, and I was given a bunch of floppy disks that had been downloaded off of the electronic health record. So that was, kind of an update, but I still had a floppy disk, or at least a CD-ROM, but otherwise things hadn't changed. But now it has. Last year, ONC finalized a proposal from the 21st Century Cures to create a trusted exchange framework and common agreement, or the TEFCA, to create a network of organizations facilitating the sharing of patient records. I'm excited to see many of these entities selected earlier this year participating today. Thank you to the potential Qualified Health Information Networks in attendance, you who will become officially part of the TEFCA network. Your work is invaluable. It'll help create a more efficient and secure method of sharing health information and improving care nationwide. As a ranking member of the Senate Help Committee, I'm committed to working with ONC and all of our public and private partners to ensure Americans have access to their health information. And as someone who has seen firsthand the devastating effect a natural disaster can have, or a pandemic can have, upon someone's ability to access care, or for that care to be accessed, I thank you all for your work. Have a great rest of your meeting.
Hello, Senator Tammy Baldwin here. For too long, our healthcare system has been fragmented, leading to challenges in care coordination and patient safety. I've heard from Wisconsinites about how frustrating it is to have their medical information not follow them as they move between different providers and facilities in our healthcare system. This lack of communication makes it harder for doctors and nurses to make well-informed decisions, timely and accurate diagnoses. It should be easy for doctors and nurses to be able to find and review a patient's medical history, regardless of where a patient was last seen. And that's why I fought to address this issue as part of the bipartisan 21st Century Cures Act, which was signed into law back in 2016. I'm also happy to see the Office of the National Coordinator for Health IT working to implement an interconnected health information system through the Trusted Exchange framework. This system will give healthcare professionals easier and more secure access to their patients' health information, reducing the likelihood of medical errors, protecting patient privacy, and enhancing the overall well-being of our families. This will be key to building a healthcare system where providers and patients can have the confidence of knowing that medical information is accurate, complete, secure, and available when needed. I want to thank the Office of the National Coordinator for Health IT and all the partners, advocates, and workers here today who have implemented this important provision. The work all of you are doing is vital to ensuring our healthcare system is better able to serve everyone. I'm proud to be doing my part in the United States Senate to protect and improve the healthcare of all Americans. Thank you, and have a great meeting.
I want to thank both Senator Cassidy and Senator Baldwin for their continued support of our work and for all that they are doing to help us continue to advance our work in health IT and interoperability of health information. At this time, I want to also thank all of our speakers. What a great start to the morning. And we are excited for the rest of the meeting today and tomorrow. At this time, we will take a short break. We ask that you please return to this room by 10 a.m. Thank you all so much.